Hi, my name's April Needs-Wiki, and today we will be talking about sinus bradycardia, what an EKG rhythm looks like with sinus bradycardia, causes and treatments as well. First off, what is bradycardia? The normal beats per minute for an adult are between 60 and 100. In general, since this is a bradycardia, Brady meaning reduced or slow, the heart rate will be less than 60 beats per minute. The sinus in sinus bradycardia indicates that the source of the slow rhythm is the sinus node, the heart's natural pacemaker. How can an EKG strip indicate sinus bradycardia? Like most sinus rhythms, the rhythm will always be regular. The P waves and the PR and QRS intervals will all fall within the normal range. It is the heart rate being less than 60 beats per minute that is most indicative of sinus bradycardia. Many of the symptoms that a patient may exhibit with sinus bradycardia come from a loss of oxygen supply in the blood to the body, brain, or lungs. Near fainting, dizziness, weakness, fatigue, shortness of breath, chest pains, easily tiring during physical activity, confusion or memory problems are all symptoms of sinus bradycardia. However, for young adults or trained athletes, a resting heart rate of less than 60 beats per minute may be normal. Thus, there would be no symptoms of bradycardia. What can cause a sinus bradycardia? The innermost layers of the heart contains the conduction system. The heart creates and transmits its own electrical signal to pump blood to the body and lungs. The sinus node sets this rhythm for the heart. So when a person has sinus bradycardia, there is something affecting the electrical conduction system of the heart. This list of what can affect this sinus node ranges widely from medications, hypothyroidism, sleep apnea, to damage within the heart from heart disease or a heart attack, just to name a few. How can sinus bradycardia be treated? Unless the patient presents symptoms, treatment may not be advised for sinus bradycardia. If possible, treat the underlying cause of sinus bradycardia, such as hypothyroidism or sleep apnea. A drug that is commonly prescribed for sinus bradycardia is atropine, which stimulates the heart to beat faster. It may be prescribed to adult patients, but isn't often prescribed in pediatrics. Oxygen can also be administered in order to help keep the blood within the patient at a high oxygen level so that symptoms from lack of oxygen in the blood aren't as problematic for the patient.